The opinions expressed in this video are my own and not those of SMA News Today, its parent company, BioNews, nor any other organization. These videos are intended to spark discussions about issues pertaining to spinal muscular atrophy and are not meant to be professional medical advice. Hey everybody, welcome to another edition of the Morale Monologue. My name is Michael Morale. Okay, so in today's video, I want to talk to you about a recent doctor's visit that I had with my pain specialist, because we talked about this sciatic nerve pain that I'm going through. Now, if you've been watching my videos, you know that I've been going through a lot of pain on my tailbone and my sciatic nerve. Well, I've been seeing this pain specialist for a little over a year now, and she gave me a prescription for Oxycontin or oxycodone, and that helps control the amount of pain that I'm experiencing in my tailbone. As a matter of fact, it will allow me to get in my wheelchair and sit for a little bit longer, and it seems like it's getting better each and every month. So slowly but surely we're addressing this issue, and I'm on a very small amount of Oxycontin, so I'm not going to become addicted to it, and I'm not going to have to worry about any side effects later on. Now, during my visit, she asked me about my sciatic nerve, and I told her that this is really the main culprit now. This is keeping me in bed and not allowing me to get in my chair. I can get in my wheelchair, but after about an hour, maybe an hour and a half, my right leg and foot and calf, they just go numb. And I have to reposition for about 15 or 30 seconds. Then I can sit back up in my normal sitting position for about another 10 to 15 minutes before that nerve starts to bother me again. And it's really affecting the quality of my life. So my pain doctor wants me to try Gabapentin, otherwise known as Neurontin. And I'm very familiar with Gabapentin because a little over 20 years ago, I was in a double-blind study where they took SMA patients and they gave them Gabapentin. Now they called it Neurontin, but it's the same thing. And their hopes were that it would maybe relax the muscle in my body or relax the muscles in our bodies to see if that would help with some of the symptoms that we were experiencing with spinal muscular atrophy. Unfortunately, the study really didn't do much. I was actually on Gabapentin and not on the placebo, and I didn't really notice any change. But I wasn't having any problems with my sciatic nerve, so I didn't know that this would help. So I was a little bit surprised when she told me about it. She told me that Gabapentin is a drug that they give epilepsy patients because it will control the way that nerves fire or activate in your body. So when I'm experiencing pain, that sciatic nerve is firing over and over and over and over, instead of just firing and then resting, and then firing and resting. It just continues. It's like if you were to shoot a gun and you just keep pulling the trigger. Well, that's what that nerve is doing. It just keeps firing repetitively over and over, and that's what causes the pain. And Gabapentin will control how this nerve activates and fires. So she put me on a very small dosage that I'm going to be taking. Unfortunately, I'm going to have to get the liquid format because I can't swallow pills, and I can't crush this and put it in applesauce. So I'm going to probably get this drug in the next week or so, and I'm going to try it. Again, my doctor said that I could take the Gabapentin along with the Oxycontin. There should be no side effects to it. And if it helps, or if it maybe allows me to get in my chair for a little bit longer of, a period of time, she'll increase the dosing amounts of the Gabapentin from, I believe I'm going to start at 15 milligrams, but she said she knows patients that are taking 600 milligrams of this. Now, I'll never be on 600 milligrams, but it's nice to know that my pain doctor is starting me out slow, and every 6 weeks when I go in, or every 4 weeks when I go in, we'll reevaluate to see if maybe we need to increase the dosing amounts. So if you're having any problems with your sciatic nerve, if it's causing your leg to go numb or your foot to go numb or even your arm, this nerve controls a lot of your body. So if you're experiencing the same kind of problems that I am, talk to your doctor, talk to your neurologist, talk to your physical therapist. But if you've got a pain doctor, talk to them because they'll know what gabapentin or Neurontin is, and ask them if this might help you get some relief from the pain that you're experiencing. A lot of people may not be experiencing what I'm dealing with, and that's great. I think that's fantastic, and I wish you nothing but the best. But if you are experiencing problems with your sciatic nerve like I am, you know that this really is a pain in the, well, anyway, I'm not going to say the word, but I think you know what I was going to say. Anyway, talk to your doctors to find out if this might help you, because it's definitely helped me. If you got something out of my video and you got some information that you think that you can use, give me a thumbs up, and please subscribe to the SMA News Today YouTube channel as well. We would greatly appreciate it. Remember, when you subscribe to our channel and share our videos and leave us comments, this will tell YouTube to change the algorithm, which will make our videos available to a wider audience, and we would greatly appreciate that. Anyway, we at SMA News Today hope all of you have had a great day. Do me a favor, this upcoming week, do something for someone else to make their day better, and do something for yourself that's going to make your life better as well. Until next time, take care of yourself, and I'll talk to you in a couple of weeks. Bye-bye.